Hello everyone and welcome to Fundamentals Chapter 23, Body Mechanics, Positioning, and Moving. So here are the learning objectives for the chapter. As you go through your PowerPoint, try to address each of these objectives, maybe take notes or just add this to part of your study. So with this chapter, you will need to identify characteristics of good posture in a standing, sitting, or lying position. You should be able to describe 3 principles of correct body mechanics, explain the purpose of ergonomics, give at least 2 examples of ergonomic recommendations in the workplace. You should be able to describe at least 10 signs or symptoms associated with disuse syndrome. Describe 6 client positions. Explain the purpose of 5 different positioning devices used for safety and comfort. You should also be able to name 1 advantage for each of 3 different pressure relieving devices. Discuss 4 types of transfer devices and give at least 5 general guidelines that apply to transferring clients. So exactly what is ergonomics? Well, ergonomics is defined as a special field of engineering science devoted to the promotion of comfort, performance, and health in the workplace. So that means whenever some examples of this is lifting objects. So you want to make sure that you stand close to the object when you're lifting it. The nurse is vulnerable to the ergonomic hazards of lifting heavy loads, and that could even be our patients. Other ergonomic hazards include reaching and lifting loads far away from the body. So if you're too far away from the body, you could cause some harm or damage. Twisting while lifting, you want to make sure that you have a nice, firm, wide base, that you're not twisting when you're lifting. And unexpected changes in load demand during a lift. So, for example, if you're lifting a box of supplies and the contents of the box shifts to one side or the other, that can cause some unexpected change in the load. So it's the same way with a patient. When you go to assist a patient from sitting in the bed to sitting in the chair, when that patient stands, if they shift to their weak side, if they've had a stroke on the right side and they shift all their weight, goes to the right side, that change in that position can cause you, the nurse, harm. So there are dangers associated with inactivity. Inactivity leads to deterioration of health. You have what's called disuse syndrome, and signs and symptoms resulting from inactivity over a short period of time. So you have a patient that's been bedridden for 7 days. They can have some weakness due to that inactivity from disuse of those muscles. So part of our nursing intervention is to constantly keep that patient moving. We want to turn that patient every couple of hours. We want to get them up in the chair, walk them to the bathroom with assistance if possible. So know that a potential for disuse syndrome necessitates a comprehensive assessment. That includes elements as cognition. Is your patient alert? What is their cognitive function? Skin integrity. Do they have any sources of area breakdown in that skin as a result of disuse or inactivity? And bowel elimination. So constipation can be a result of that disuse syndrome, that inactivity that the patient may have. So to keep those bowels working, make sure you're moving that patient. So disuse can lead to, we already talked about, some muscular problems. So you have weakness, decreased tone and strength, decreased size, so the muscles can actually waste and the extremities can get smaller. We can have skeletal effects, poor posture, contractures, foot drop can occur. As far as cardiovascular, well, that's impaired circulation. So if you're not moving those extremities with passive range of motion or just that constantly turning and flexing, however you want to exercise your patient, you're impairing that circulation. And if you don't have good circulation, you can have the results of a clot. Clots can form in the extremities. And then you can have also dependent edema. That can be just from lying in one position too long. So, for instance, if a patient's lying on their right side for 6 or 8 hours, their right arm can become edematous. Their right leg can become edematous. Respiratory, that's a big effect with disuse and not moving. So those secretions can pool in the patient's throat. So you can have all these secretions can build up in the patient's mouth because we're not facilitating that swallowing by keeping them moving and changing their position. They may have shallow respirations because we may be on the verge of creating a pneumonia because we didn't turn our patients frequently enough. They may have that atelectasis, which is collapsed alveoli. That can occur. And when that happens, your patient will surely be at risk for developing a pneumonia. So movement also affects urinary function. It affects urinary to the point that you can have scant urine because the patient's not being in a position to maybe empty their bladder as well as they could. Urinary tract infections because we're not getting that patient up to void. They're maybe just lying incontinent in urine. We can also, stone formation can occur, and incontinence because we're not strengthening those muscles, we're not using them, getting that patient in the proper position to void, so they lose some of that muscle tone and may develop some incontinence. So non-movement can also lead to GI problems such as anorexia, and as I already said, constipation, and even fecal impaction. Integrity, skin sores for sure, on the coccyx area, on the heels, even on the ears, the elbows. The skin's just going to be really at risk for developing breakdown if the patient's not moved frequently. It can also impact our metabolic rate, which is part of our endocrine system. It can actually slow that down because we're not expending any energy or any effort whenever we're moving, so that metabolic rate may slow down. And it may also decrease hormonal secretions related to the endocrine system as well. With our nervous system, you may have some sleep pattern disturbances, as well as some psychosocial changes from just not having any interaction, but definitely the sleep pattern disturbances, will definitely see some of that occasionally. The patients will become confused or they will become disoriented. They don't know the days and the time because they've had very little interaction. And during the day, they should be moving a lot during the day. During the sleep time or the sleep period at night, you may want to go maybe a 3-hour turn instead of a 2-hour turn. Maybe just give them a little bit of sleep time. But just know that if a patient's immobile, if they're not able to move and change their position, even during sleep, that can cause some effects whenever they're awake. So posture and mechanics. It's very important to maintain good posture. And that affects the way a person, their appearance, it affects their stamina, the ability to use the musculoskeletal system effectively. Good posture also affects our standing, sitting, and lying. And poor posture can lead to muscle spasms. As far as our body mechanics go, we need to make sure we use proper body mechanics. such as distributing weight equally on both feet, providing us a broad base of support whenever we're lifting, maintaining the hips at an even level, bending the knees slightly to avoid straining the joints, holding the chest up slightly and forward, and extend or stretch the waist to give their internal organs more space and maintain good alignment of the spine. So it's really important to maintain good body mechanics, and that will help support our posture as well. In a good sitting position, the buttocks and upper thighs become the base of support. Both feet rest on the floor. The knees are bent with the posterior of the knee free from the edge of the chair to avoid interfering with distal circulation. The knees should also be separated by a small distance to maintain a neutral position. The feet should be flat on the floor. Consequently, they would not be directly below the buttocks, but would rather be below the position of the knees. So lying down posture is just as important as our sitting up posture. Good lying down posture, the head, neck should be centered between the shoulders. The shoulders should be level. The arms, hips, knees should be slightly flexed. The trunk of the body should be straight with the hips level and the legs parallel, feet at right angles to the legs. So make sure that the knees are slightly flexed, and this will relieve joint discomfort. So good body alignment. Whenever you are turning that patient, you need to look and see is their body has good alignment and support. If it doesn't look comfortable to you, then it's probably not comfortable to your patient. So when you are turning them from side to side, look and see how you have them lined up. Look at their back, look at their hips. Make sure that those joints are slightly flexed so that you won't have that joint discomfort in their knees or in their elbows. So just look at your patient when you turn them and make sure that if it looks comfortable to you, then they probably are. But if it's an uncomfortable looking position, then maybe you need to assist them and get them to a more comfortable lying posture. When it comes to positioning our clients, we need to change the inactive client's position at least every 2 hours. You should enlist the assistance of at least one other caregiver. And before you even start the procedure, be sure to remove all of the pillows and positioning devices. Common positions: supine, lateral, lateral oblique, prone, Sims, and Fowlers. In the supine position, the patient lies on their back, and if they lay on their back for too long a period of time, this could develop in what's called foot drop. And foot drop makes the client drag their toes on the ground while they're walking. It is a permanent dysfunctional position that's caused by the shortening of the calf muscles and lengthening of the opposing muscles on the anterior leg. In the Sims position, the client lies on their left side with their right knee drawn up towards their chest. This position is used for conducting examinations and procedures involving the rectum and the vaginal area. The Fowler's position is especially helpful with those clients who are experiencing shortness of breath because it causes the abdominal organs to drop away from the diaphragm, and this relieves pressure on the diaphragm and it allows the exchange of a greater volume of air. A high Fowler's position is an elevation of 60 to 90 degrees, so that high Fowler's position is almost straight up position. So whenever you are positioning your client, make sure that you raise the bed to a good working height, that you spread your feet shoulder width apart to broaden the base for support, and use a draw sheet to assist with log rolling the client. Now, if you're trying to change the position of someone who's having difficulty communicating, maybe you want to demonstrate or use some hand signals to show or illustrate that you want to change their position or help them turn over to their side or help them up into a chair. But you may want to try to have some type of communication system with someone who has some lack of verbiage or some lack of understanding what you're trying to convey when it comes to changing their position. So there are a lot of positioning devices out there that we can use: adjustable beds, mattresses, bed boards, pillows, roller sheets. Nurses use roller sheets whenever you're changing a patient to an alternate position. This kind of helps you from stooping over too far or reaching too far, and also prevents you from twisting a lot in your upper body. The sheet should be kept dry and free of wrinkles, and this will prevent any skin breakdown. So whenever you get the client repositioned, check that draw sheet, make sure that it's back straight or flat. If you notice any moisture either from incontinence or diaphoresis, you want to change that draw sheet, because we need to make sure that that roller sheet is dry and wrinkle free to prevent any skin breakdown. Log rolling, that's another technique that we use lots of times with a client who's had any surgery or they've had an injury involving their spine and neck. So you want to make sure that the body's in good alignment position, and you roll their body in one smooth, easy motion altogether. It helps maintain that spinal alignment and prevents any further injury. It maintains the natural alignment of the client's body. And lots of times we'll use a draw sheet or a roller sheet to help us facilitate that smooth motion, that smooth movement to reposition that patient. When you get a chance and you're looking at your PowerPoints, be sure to click on the links for this Roto Prone bed and the therapy beds. They proved to be a little interesting to watch. Other positioning devices we used, trochanter rolls. These prevent the legs from turning outward. The trochanters are the bony protrusions at the head of the femur near the hips. Placing a positioning device at the trochanters help to prevent the legs from rotating outward. Hand rolls are devices that preserve the client's functional ability to grasp and pick up objects. So you may see a hand roll, and sometimes that can be just as simple as a washcloth rolled up or folded and placed inside the client's hand. We also use what's called foot boards, boots, or foot splints. So in a client who is unable to reach the footboard, if they can't reach their footboard to put the feet against to prevent that foot drop, we can put on what's called a foot splint. And a foot splint allows more variety in body positioning while maintaining the foot at a functional position. If a foot splint or board is not available, the nurse can use a pillow or a large sheet to place at the foot of the bed at the patient's feet to keep them at an upright position. So make sure that you use proper body mechanics. That increases muscle effectiveness of the client. It reduces fatigue for both us and the client. Use those assistive devices and additional caregivers if you need to, because sometimes it takes more than one or two people to change a client's position, especially one who doesn't have any independence and they depend on us for their repositioning. So use those assistive devices and additional caregivers. So the device on the left is an example of the footboard that could be placed at the end of the bed, and as you see, that keeps the feet in that upright natural position like a patient would be standing up. It gives them something flat to rest their feet against, and that prevents foot drop from occurring. The device on the right is an example of the trapeze bar, and use of a trapeze bar helps a lot of bedridden patients maintain some independence. It hangs over the bed and they can grab it with their upper body and help you position them in the bed, and or they can position themselves depending on how strong they are with their upper body. So it just helps maintain some of that independence. Some facilities use what's called a repositioning algorithm, and this is an example of that. Like, can the patient assist? Yes or no? If no, then they need to use a body sling lift and two or more caregivers. If the patient can assist, then you move over here to the yes. Are they fully able or partially able? And as you see, you go down the algorithm, and that helps you decide what you will need to reposition that patient and cause you little to no harm. So side rails can be beneficial in helping position a client. The client can maybe grab the side rail and help you roll them over, or it can help them pull up to a sitting position, or even help them pull up in the bed. So use the side rails whenever you can. Have the client grab the side rails instead of you if possible. We also have some overlays that you can put on the mattresses, and this will facilitate smooth movement of the patient across the surface of the mattress. And they come in foam, gel, static air, alternating air, and water. Occasionally, we'll have to use what's called a bed cradle. And this is another device that can be used, and it protects the feet and lower legs from the bed linens. So if you have a client who's had some severe burns to their lower extremities, the use of that bed cradle at the foot, and then you can just drape the sheet on top of it, it keeps the sheet from actually touching the skin. Just forms that shell. These alternating beds or specialty beds, as well as some of the mattress overlays, will help prevent some skin pressure and some skin ulcers from developing as well. So with an oscillating bed, this relieves pressure and helps to mobilize respiratory secretions, while the circular bed promotes a sense of control among otherwise dependent clients. Your air fluid bed allows the client to float, gives them a float feeling, and prevents skin irritation. And then your low air loss beds maintain capillary pressure well below what that's normal in the blood flow. So you have different types of bed depending on the need of your client. So this is a picture of what a bed cradle looks like. It forms a shell over the client's lower legs, keeps the linen off the feet or legs. It's often used in clients with burns, painful joint disease, and fractures of the lower legs. Transferring aids, I highly recommend use transferring aids whenever possible. Transfer handles, transfer belts, transfer boards, these are great. And a mechanical lift if you have access to one. They're great to move or transfer that patient, that client from the bed to the chair. So some clients with strong arm and upper body muscles can be transferred easily with the use of a board independently. So you can turn them, put them on that board, and slide the board over, so the patient has to use very little. Transfer boards are positioned in such a way that the client's buttocks or body can slide across what would be an otherwise open surface or gap at the height of the two surfaces. So when you look at this picture, you see there's a gap between the stretcher and the bed. So the board actually just is easy just to roll the patient back onto the board, and you just slide the board over into the stretcher of the bed wherever you want to move them to. But I highly recommend using transfer aids when possible. When transferring a client, we can use devices such as mechanical lifts or hover mats. Whenever we are nurses transferring a client from a bed to a chair, chair to a bed, or to a stretcher, there's some things that we need to keep in mind when we're doing that. So you should always assess the client's strength and mobility, because doing so helps determine the need for additional personnel or the use of one of these transfer devices, such as a mechanical lift. When you're getting ready to transfer that client, make sure that you arrange everything so it's as close to the bed or the chair as possible to the client. Make sure it's on the client's strong side. That will ensure some safety. Make sure that you have locked everything. Lock the wheelchair, lock the stretcher, lock the bed before you go to transfer the client. Because there's nothing worse than standing the client up, you're pivoting towards the bed, and the bed starts to roll because you failed to lock it. That can be a real safety concern. So make sure that you lock everything. Now, a mechanical lift is best used for your heavier clients or those with limited mobility. A mechanical lift can also help you is a positioning sling that can help with repositioning the client as well. So anytime you're using or you have that client who's obese or they have very limited mobility, sometimes the use of that mechanical lift is to your advantage. So when a client is being discharged home, we want to make sure that they have everything there that's going to make sure or keep them safe. And one of those things would be promoting ambulation, promoting independence, but we want to keep them safe as well. So make sure that you've discussed with the home health agency or the family or the caregiver to make sure that there's some adequate handrails. Are there handrails beside the toilet? Is there a handrail in the shower? Is there a handrail close by that the patient or the client's going to be able to use whenever they want to stand up or they want to move? Make sure that there are handrails available. No loose rugs or throw rugs on the floor. Throw rugs are a no-no. So those throw rugs need to be discarded. The nurse should make sure that if the client's using that wheelchair at home or they are going to get a wheelchair, that they don't have what's called that hammock effect. That hammock effect is whenever the seat of the wheelchair droops down. So to prevent that or to keep that from happening, you can actually put a gel or foam cushion in the wheelchair, and that will prevent that from happening. And that will give the client a little bit better body position whenever they're sitting up in the chair. So consider those kind of things when a client's being discharged. What condition is the wheelchair in? Do they have adequate handrails at home, in the bathroom, in the shower, outside, at the steps when they're coming up into their house? Make sure that the safety is addressed for that client who's being discharged who may have limited mobility. Be sure to take care of yourself. Be very careful at work whenever you begin working, whether it's in a hospital or in a clinic or in a long-term care facility. Take care of yourself. Use all the devices that you can. They're at your disposal to keep your back in good health. Texting neck, yeah, I put this in here. Many of us are guilty of this texting neck, so make sure you have good posture whenever you're texting. When you're sitting down charting or you're using that computer charting, make sure that you keep your elbows flexed, or use wrist rest to keep your wrist in a neutral position when you're doing that computer work. Make sure that you have non-glare lighting to avoid any eye strain. Those blue eyeglasses seem to help a lot with reducing that eye glare. So make sure that you are taking care of yourself in the workforce. Before you get to the workforce, whenever you're in your clinical rotations, be safe, take care of yourself, and ask for assistance if you need it. And that concludes chapter on body mechanics, positioning, and moving, chapters 23, fundamentals. Thank you.